हेलो हेलो। आवाज तो जा रही है। आईपैड की स्क्रीन दिख रही है?
यस। सर आपका स्क्रीनशॉट लेके सर को भेजिए। स्क्रीनशॉट या यूट्यूब पर लिंक मैं सबको भेज देता हूँ, उससे सबको दिख जाएगा। हाँ हाँ हाँ। तो पहले आपके वो फोटो विजिबल थी एंड देन उसके बाद आपने अभी जो चेंज किया ना उसके बाद विजिबल नहीं है।
सब क्यों हो रहा है?
मैंने आपको यूट्यूब पर लिंक भेज दिया।
अच्छा, ओके सर। जी।
मैंने आपको भी भेज दिया। आई कैन सी ये पास स्क्रीन लैपटॉप पे भी है।
अब मैं दिख रहा हूँ शायद क्या? मैडम, मैं विजिबल हूँ। और ये आईपैड स्क्रीन दिख रही है क्या?
iPad स्क्रीन तो दिख रही है।
तो
सर मैंने आपको यूट्यूब का लिंक भी भेज दिया है।
अच्छा,
So now you are visible on YouTube. Nitin sir एक बार चेक करिए, sir is visible on YouTube also. Yes, yes, yes. Okay.
हेलो डियर स्टूडेंट्स। होप ऑडियो वीडियो एवरीथिंग इज ओके। प्लीज इन्फॉर्म मी दैट एवरीथिंग इज गुड। यस, गुड इवनिंग एवरीबॉडी। हेलो एवरीवन। आई थिंक ऑल थिंग इज गुड। Hello, dear students. Hope everything is okay. Can we start? Visible and audible. Okay, thank you. Thank you, Manshu. Thank you. Thank you, Sanjay. Okay, so we are starting the session. Okay. So let's start this beautiful, amazing session. सिर्फ हंगामा खड़ा करना मेरा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए। हमारे सीने में नहीं तो तुम्हारे सीने में ही सही, कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए। So very warm welcome to all of you at our this beautiful, amazing platform. So right now I am here to discuss the anatomy in the physiology, few doubt session, few MCQs, live doubt session. So we are going to discuss this all the doubts with the help of the MCQs. Okay, please keep comment so that I can know that everything is okay. So here is the first question. Yes, if a person suffers a stroke and damage occurs at the occipital lobe of the brain, which function is the most likely to be affected? Tell me, what is your answer? Yes, option A, the ability to write. Option B, speech. Option C, hearing. Option D, vision. What is your answer? Hmm? The big clue, the occipital lobe. Okay, answer. So Anjali is saying D, vision. Manshu is saying D. Yes, Khatun is saying D, Ginny, D. Vision. So all are saying the vision. Very good. Answer is the vision. Do you remember? We had observed already. Yes, sir. Suppose this is the our cerebral hemisphere. Okay. So there is our central sulcus. This is the lateral sulcus. There is one sulci between the parietal lobe and the occipital lobe. This is the parieto-occipital sulcus. Imaginary line joining the parieto-occipital sulcus to the pre-occipital lobe, and you have to extend this occipital sulcus posteriorly. So in front of this our central sulcus, this is the frontal lobe. Can you tell me what is the main function of the frontal lobe? Little doubt discussion. Yes, the frontal lobe is responsible for the behavior, judgment, personality, good decision, bad decision, this all. And just in front of the frontal sulcus, this is the prefrontal gyrus. Sir, this is the area number 4. This is the our main motor area. So it is controlling the motor activity. If there is a damage in this frontal lobe, loss of the motor activity, sir, that is our, you can say, the paralysis. Now, this our parietal lobe behind the central sulcus. Sir, this is the parietal lobe. This parietal lobe is having the area number 312. Sir, 312. Sir, this is our sensory area. Sir, here is our motor area. So if there is a damage in the sensory area, loss of sensation, damage in the motor area, loss of motor activity. Okay. Yes, frontal is also related with the talk. You are right, nitrous oxide. Now, this is our temporal lobe. Yes, sir. This is our what? Temporal lobe. Right, sir. This is our temporal lobe. Temporal lobe is having the superior temporal sulcus, inferior temporal sulcus. So it is divided into the gyri. Okay, sir. Just to the our central sulcus, there is a our particular area number 41 and 42, primary auditory area, and around it there is our area number 22. So this is the 41 and the 42 area, and around it you can see this particular part, sir. This is our area number 22. Okay, so this is the our 41, 42, and this is the area number 22. So area number 41, 42, primary auditory area. So if there is a damage in this area, the hearing function will be affected. And now come to the our occipital lobe. There is the our sulcus. This is the, yes, calcarine sulcus, around which there is the our, yes, you can say the lunate sulcus. This is the occipital lobe, and this occipital lobe is mainly responsible for the visual activity. Yes, here is our area number 17, and around it area number 18 and 19. So this is responsible for the vision. This is responsible for the mainly hearing. Okay, so the main activity, if there is a damage in the frontal lobe, motor loss. If there is damage in the parietal lobe, sensory loss. If there is damage in the our temporal lobe, hearing loss. If there is damage in the our occipital lobe, visual loss. Agree, beta? Done? So answer in this question is vision. Any doubt? Okay. Okay. Now come to the next. Yes, Varsha. Good evening, beta. Next question. Yes, I think it is easy question. Winging of the scapula is due to the paralysis of. Yes, yes. Axillary nerve. No, sir. Axillary nerve supplies to the our deltoid muscle. Fine. Teres muscle. No. Long thoracic nerve, sir. It supplies to the serratus anterior muscle. Yes. The boxus muscle, serratus anterior. The median nerve, it is supplying the nerve of the forearm, anterior compartment radial nerve on the back side. So look here. The serratus anterior. Again, say lal fool, neela fool. Anatomy, beautiful. Yes, look here. The beautiful three-dimensional anatomy. Can you see? This is the platysma. Sir, pectoral region. The big muscle at the pectoral region, this is the pectoralis major. Cut this muscle, remove this one. At the pectoral region, the small muscle. Pectoralis minor. Cut this muscle. Okay, sir. Now at the pectoral region, one is small muscle just below the clavicle. So this is the subclavius. Okay, sir. Now this is the another muscle. This is the 𝐔𝐩𝐜𝐜, serrated in appearance. So this is serratus, and it is on the front side. So it is the anterior. You see, this muscle is attached to the scapula. Yes, where? Along the medial border. So this is superior view. When this muscle will contract, it will move the scapula forward. So forward movement of the scapula, yes, it will help in the forward movement of the arm. So it is helping in the pushing and punching action. That's why this is also known as boxer's muscle. Okay, sir. Yes, the medial border is holded by the serratus anterior, which is supplied the long thoracic nerve. So if there is a damage in the long thoracic nerve, the support of the medial border of the scapula is removed. So a small elevation is produced at the back. That is a winging of scapula. Done. I think there is no doubt. Okay. Just one simple diagrammatic presentation. Suppose this is our what? Sternum. And suppose this is what? Our vertebra. This is the vertebral canal. Suppose this is the our rib. Yes, only one side we are drawing. Here is the our scapula. Lateral side is having the glenoid cavity and medial side is having the medial border. Okay, sir. This glenoid cavity is, yes, articulating with the humerus. Suppose this is the diagrammatic presentation of the humerus. Right, sir. Sir, the serratus anterior muscle, the boxer's muscle, it is arising from the rib lateral side and it is getting insertion into the scapula along the our medial border. Are you getting the point? Yes, Bhagyashri, good evening, beta. Now, catch this one. When there is a contraction of this serratus anterior, where muscle goes, there movement flows. So it will pull the humerus also towards the forward. Yes. So this is our which muscle? Sir, this is the serratus anterior. Sir, this serratus anterior is causing the forward movement. This forward movement of the our scapula, this is simply the protraction of what? Scapula. Okay, so do you remember? Yes, the forward movement of the scapula, protraction, the backward movement of the scapula, retraction. Hollywood, Bollywood, Tollywood, all arises from the anatomy. The famous dancer, yes, famous Bollywood heroine, Madhuri Dixit auntie, she is using this scapular movement forward, backward in her song. And what is the song? Thak thak karne laga. Yes, she's doing forward movement, protraction, backward movement, retraction. Re mora jiyara darne laga. Yes. So everything is arising from the anatomy. Don't forget this one. Okay, sir. So this is the protractor muscle. Madhuri Dixit auntie is using this serratus anterior for the protraction. So when it is protracting, the humerus will also move forward. Agree? So when the humerus is moving forward, then it is what, sir? This is our pushing and punching action. Are you getting? Yes, yes, yes. Hope you all understanding. Yes. Shakti, Mahendran, Manshu, you are getting. Okay. Okay, sir. So this pushing and punching, MCQ, MCQ, this activity is done by the our boxer. That's why this muscle is known as the boxer's muscle. Okay. Yes. MCQ, because it is causing the pushing and punching. The nerve which is supplying the serratus anterior, that is running with the long course in the thorax. That's why long thoracic nerve. Sir, this long thoracic nerve was studied by the anatomist Bell. That's why it is also known as Bell's nerve. MCQ, MCQ. Remember the 2B, 2B, B for boxer, B for Belsner. Okay, yes, you're right, Disha. Fine. Now, look, if this muscle is getting paralyzed, if this muscle is getting paralyzed. Okay, sir. So there is a loss of support of the medial border. So the patient will present with the scapula, but the medial border is getting elevated. So elevation of this medial border of the scapula, sir. Elevation of medial border of what? Scapula is known as winging of scapula. MCQ. Okay. So in the clinical exams, they are asking the question like, yes, winging of scapula. So you can see at the screen. So this is the elevation of the medial border of the scapula. This is the winging of scapula. Okay, complete. No question will be asked outside this zone. Any question, any doubt, please ask. Can we move for the next? Done? Okay. Look for this one. Yes, I'm using this image for all of you. Nowadays they are asking the question, image based question also. Go at my Insta, go at my YouTube channel. You will see the very funny correlation, Hollywood, Bollywood, Tollywood integration. So there is a Madhuri Dixit auntie dance also for the protection and retraction. You can get at my Insta. Okay. Okay, sir. So this is the winging of scapula. Sir, elevation of the medial border. This is our winging of scapula. Okay, sir. Now come to the next question. McBurney point is, okay, McBurney point. What is McBurney point? Yes, yes, tell me. Yes, what is the McBurney point? Option A, 1/3 distance from the left anterior superior iliac spine, 2/3 distance from the anterior superior iliac spine, 1/3 distance from the umbilicus to the ascis anterior superior iliac spine, 1/3 distance from the right anterior superior spine. Tell me, McBurney's point. What is a McBurney's point, sir? It is the point of maximum tenderness for appendicitis. Okay. Now tell me, appendix is on the right side or the left side? Sir, appendix is on the right side. So remove this option. It is given the left. No, it is not the answer. Yes, here is the right. So it may be the answer. Okay. Now the question. Seen appendicitis. Yes, you are right. Now the question that this is which part, which portion. So I'm going to draw one image for all of you. Look here, sir. Suppose this is our waist part. Here is the hip part. Okay, sir. So at the waist, there is the one bony elevation by the our hip bone. Sir, this is the anterior superior spine. Sir, it is on the front side. So what you will say? Anterior above, that's a superior iliac bone, that's a iliac spine. Okay, sir. Sir, here is the our pubic tubercle, pubic crest, pubic symphysis. Same pubic tubercle, pubic crest, pubic symphysis. Right, sir. Sir, there is a one ligament between the anterior spine and the pubic tubercle. So this is our inguinal ligament. Right, sir? This is the inguinal ligament. Sir, umbilicus is here. Okay, fine. Sir, appendix is located in the right iliac fossa, not in the left iliac fossa. So pain is on this side. Now there was the one anatomist, one surgeon, who studied about this fact, cases of the appendicitis. It is referred along this line. Sir, this is our umbilicus. Sir, This is our ascis, anterior spine. So this blue color line is representing the spino-umbilical line. Are you getting? Break the name and think about it, sir. This is our spino-umbilical line. Now, the McBurney observed the maximum site of the pain is at the junction of the medial two-third. Junction of the, yes, medial two-third and the lateral one-third. The maximum cases of the appendicitis, the maximum pain has been seen at this junction. Okay, so this is our McBurney's point. Remember, M for Mac, M for medial two-third. So who is your friend? Sir, M is our friend. M for McBurney's point, M for medial two-third. So, yes, this is our lateral one-third. Yes, sir. So this will be the lateral one-third. So this junction between the medial one-third and lateral one-third. M for medial, so give the maximum number to the medial. Don't do at time of the exam medial one-third. No. M for McBurney, M for medial, give the maximum number, medial two-third. And so obviously lateral one-third, this is just small. Fine. So according to this option, can you observe the things? Medial one-third distance from the right anticipatory spine? Yes, it is right. One-third distance from the umbilicus to the ascis? No. Two-third distance from the anticipatory spine? No. D is the answer. Is it okay? Yes, Shruti, you are right. So can we move? Right, come to this. Commonest site of the peptic ulcer. Option. First part of the duodenum, second part of the duodenum, distal one-third of the stomach, pilus part of the stomach. Can you tell me? Yes, look for the options. Just tell me the answer. Yes, dear students. Yes, Hamid is saying A. Manshu is saying A. Disha is saying A. Aditi, Shakti. Yes, Aditi, Shakti saying C. Neha is D. Yes, look here. Peptic ulcer disease, important. Sir, the peptic ulcer disease. It is two types. Duodenal ulcer disease and gastric ulcer disease. Okay. The ratio, general ratio is 4:1. The duodenal ulcer, it is found 4 times and the gastric ulcer disease 1 time. Suppose 1 ratio. So most common duodenal ulcer disease more commonly seen the gastric ulcer disease. Okay, sir. Look for this all. What you have to remember, sir, there is the our stomach, sir, esophagus, fundus and the body. This is the laser curvature, and here is the our duodenum. First part of the duodenum, second part of the duodenum, third part, fourth part, so on. Remember, the stomach is divided into the mainly the two parts. This is the cardiac part, this is the pyloric part. Now each part again divided into two subdivision. So this dome-shaped part is known as fundic part. This big portion is known as body. Yes, the remaining, the pyloric part, again it is divided into two division. Okay, so this big portion is cavity like. So this is the pyloric antrum, and the next part is having the canal like appearance. So this is the our pyloric canal. What I want to tell you, sir, parts of the stomach. Sir, this is our fundic part, also can say fundus. Sir, this is our body. These are the two parts of the stomach, you can say. Sir, these are our cardiac part. Also, you can say, sir, these are our, yes, you can say the esophageal part. Now, this is our pyloric antrum, and this is our pyloric canal. So these are the two subdivision of the pyloric part. Remember, here is the our duodenum. First part of the duodenum D1, second part of the duodenum D2, third part of the duodenum D3, and this is the last part D4. The Helicobacter pylori, the main cause of the duodenal ulcer. Yes, it is found in the first part of the duodenum. Are you getting? So remember, this first part of the duodenum is the most common site for duodenal ulcer disease, DUD, MCQ. And it is more common, it is 4x time. So definitely the most common site for the our duodenal ulcer disease, which is the type of the peptic ulcer disease, is the first part of the duodenum. More things, whenever we are taking the hot tea, the spicy food, it is coming along the esophagus and it is causing damage along the laser curvature, and it is causing the maximum insult along the laser curvature. Are you getting the point? Okay. Yes, it is causing the damage along the laser curvature. So there is the our gastric ulcer disease along this our, yes, you can say the our point, this small angle along the laser curvature and the duodenum, this is known as the incisura angularis. Yes. So hot tea, the spicy food, these are doing maximum insert here. So this is the most common site for gastric ulcer disease. But this is less commonly seen. More commonly the duodenal ulcer. So if you have to opt the best answer, the D1. More thing. Second most common site. Yes, sir. Second most common site for duodenal ulcer disease. Answer is the pyloric antrum, MCQ. MCQ. Okay, we covered the many MCQs from the single question. Agree, beta? Fine. Okay. So in this question, the answer is the first part of the duodenum. Agree? Come to the next. Yes. Carpometacarpal joint is example of which type of the following joints? Again, give me the answer. Yes, good evening, Muhammad Altaf. Examples: ellipsoid, pivot, saddle, hinge. Yes, Priya, you are right, because the stomach is having the protective layer also. Tell me answer. Disha is saying A. Mitali A. Manshu A. Suprabha A. Fatima is saying A. All are saying A. चलो सब A बोल रहे हैं तो A ही होगा. मान लेते हैं आपकी बात. What is our carpometacarpal joint? Look here, sir. Carpal bone and the metacarpal bone. So look at your hand, sir. There is a metacarpal bone. Okay, and here are the our carpal bone. So the carpal bone and the metacarpal bone. Fine. Carpometacarpal. Okay. So here we are going to look at the carpometacarpal joint. Look at this question. We are observing the three-dimensional orientation. Sir, carpometacarpal. So this carpometacarpal joint is which type of the joint? Fine. AAA. See here, this metacarpophalangeal knuckle, metacarpophalangeal. This is the example of what? Ellipsoid joint. Look here. It is ellipsoid. No, it is not the ellipsoid. Yes. In this question, none is the answer. This is the plain synovial joint. This is the plain synovial joint, na? Okay. See here, the carpo-metacarpal joint. So this is the joint. First carpo-metacarpal. This is the saddle joint. But remaining are not this kind of the variety. You will see the plain side, the carpo-metacarpal and the tarso-metatarsal. These are the example of the sign. So this is not a correct question. Okay. Answer is our plain synovial joint. Okay. If they will give the first, look here, generally this question, I think in this question the first word has been first carpo-metacarpal, then answer is the saddle joint. Why the saddle? Because you can see there's a convexity as well convexity as well as concavity. Okay, so this is having the S shape, so this is the saddle joint. Okay, so again, one quick revision for all of you for the joint. Tell me what is a joint, sir? Junction between the two bones is known as the joint. One question showed from the joint, na? So this is the joint, junction between two bones. Now catch here. So if the two bones are joining together with the help of the fibrous connective tissue, fibrous joint. If the two bones are joining together with the help of the cartilage, then what you will say? Cartilaginous joint. Okay, sir. And if the two bones, they are uniting together with the help of the synovial fluid, then it is our what? Synovial joint. Yes, sir. There is our synovial joint. Agree? So there are the three types of the joint. Fibrous joint. If cartilage is there, so cartilaginous joint. Fibrous, cartilaginous, and here the synovial fluid. That's why synovial joint. Three types of the joint. Joint are three types. You can remember the mnemonic FCS. Yes, FCS. Fox. Okay. One non-vegetarian mnemonic you can remember. Okay. Joint fox. Jarur, definitely one question from the joint. So you can remember the FCS. Now see, what are our different other types? F for, you can remember the mnemonic सा सु जी, अर्ज किया है. स्टूडेंट की भी क्या लाइफ है, ना हस्बैंड है ना वाइफ है. यस, दे कैन नॉट टेल देयर पेन टू एनीवन, but after the marriage you will have the sasuji and sasurji. You can tell your pain to the sasuji and sasurji also. Sir, fibrous joint is having the S for suture. Yes, S for sin, desmosis. Yes, Shivani, you are right. You can do the CSF also. Yes, C for cartilage, S for suture, S for your fibrous, S for synovial. Okay, cartilage, synovial, fibrous. So this is the one another way, but the sequence is getting changed. Anyway, anyhow, you can remember. Okay, sir. Now G for sir, gomphosis. Okay. Now the cartilaginous joint, sir, cartilaginous joint, two types, primary and secondary. And synovial joint, sir, these are having the further more types. What are the different types of the synovial joint? Our funny mnemonic, the प्रियंका चोपड़ा आंटी से बहुत प्यार हुआ. Yes, Salmon Boy, the brand ambassador, is saying Priyanka Chopra auntie से बहुत प्यार हुआ. Sir, P for plain synovial joint, C for sir, condylar joint, S for sir, the saddle joint, E for ellipsoid joint, B for ball and socket joint, P for, you can remember the pivot joint, and H for, you can remember the hitch joint. Agree? Getting the point? So this is the classification of the joint. Okay. So this is the one quick revision. Now come to the next question. A nurse is working in an OPD. During the patient history, the patient reports, I tore 3 of my 4 rotator cuff muscle in the past. Which of the following muscles cannot be considered as the possibly being torn? Now tell me options: teres minor, teres major, supraspinatus, infraspinatus. Anyone? What is the answer? Yes, yes, yes. Anyone? Please try. I'm giving the clue. Which muscle is not the part of the our rotator cuff? Now tell me. Mitali is saying C. Supraspinatus. Yes, you are right. Supraspinatus. Anyone? If in support of the Mitali, supraspinatus. Is it right? B. Okay. Akshada, Aishwarya, yes, B. So they are saying the B. Teres major. Shall we sing B? Though, so now maximum option for the B. Look here, what are the rotator cuff? The three-dimensional orientation again. Lal full, Neela full, anatomy beautiful. Yes, Jarvis system. This is the delta shape muscle at the shoulder, deltoid. Cut it. Can you see, sir? This is the biceps. Cut it. Look here. This is shoulder joint. Sir, shoulder joint. There are the certain muscle which are making the rotator cuff. The first muscle you can see the supraspinatus. Within this rotator cuff, the head of the humerus is properly rotating. So this is the rotator cuff. Okay. So this is the first muscle of the rotator cuff, supraspinatus. Cut it. Then infraspinatus, it is making the rotator cuff. Cut it. This is our teres minor, not the teres major. No, yes, teres minor is around the shoulder joint, and this is subscapularis. Yes, it is crossing the shoulder joint. So these are subscapularis. So all are crossing the shoulder joint. But can you see this teres major? This teres major is away from the shoulder joint. This is the shoulder joint at the screen. No brown color fiber is here. Shoulder teres major is away from the shoulder joint from the rotator cuff. The one way how you can remember, look here, sir. There is the our rotator cuff. The muscles of the rotator cuff you can remember with the one mnemonic SITS. Sits. S for supra, above the spine. That's why spinatus. I for infra, below the spine. That's why spinatus. I had written the T with the small letter. So this is teres, small. That's why minor. And S for sub scapularis. So remember, teres major. Sir, it is away. So which is not the component? Teres major is not the component. Agree? The rotator cuff muscle, they are also known as the dynamic stabilizer of the shoulder joint. Yes, sir. These are rotator cuff muscle. This rotator cuff is also known as the musculo tendinous cuff. Yes, it is also known as the musculotendinous cuff. Fine. Sits muscle. Okay, sir. Now come to the next. A section divides an organ into top and bottom. So what should be the name of this section? Sagittal, coronal, oblique, or transverse? Tell me the answer. I think it is easy question. ना वफा होगी ना वफा की बात होगी, जो भी चीज होगी एग्जाम के बाद होगी. यस, फोकस. वैलेंटाइन डे चला गया है. So the students, they are giving the answer D, D, D. Who is saying the B? Sarah. No, it is not the B. It is the D. Okay. So remember, this is our, suppose, one patient. क्या नाम है? So whenever they are asking क्या नाम है, your answer should be Bhupinder Jogi. Suppose he is our patient Bhupinder Jogi. So any plane which is dividing the body into the two equal half, this is known as median. Also you can say the mid-sagittal. Sir, this is the mid-sagittal plane. Any plane which is parallel to the mid-sagittal plane. So these are the our, yes, sagittal plane. Any plane which is parallel to the ground, that is known as transverse. Yes, this is dividing the body into the upper and lower, top and the bottom. So answer is the our transverse. Transverse is the best answer. Yes. The coronal, what is the coronal? Suppose this is our body, eyes, nose, mouth. So any plane which is dividing into the front and the back, this plane is known as, sir, frontal. Also you can say the coronal plane. Agree? Done? Front and the back. So the plane which is dividing in front and back, that is the frontal or coronal. The plane which is dividing into the up and the down, sir, that is our simply the transverse. I think every concept is okay, clear. Now the next question. Urinary bladder is lined by simple squamous epithelium, simple cuboidal epithelium, transitional epithelium, and pseudo-stratified columnar epithelium. I think again it is the easy question. Yes, very good. Kridha, Ginny, Suprabha, Ram Kishore, Kajal. Okay, Payal. Urinary bladder is lined by C. Drama Queen is saying D. Drama Queen. Wow, what a great name. Anjali is saying D. No. Urinary bladder, it is reservoir of the urine. Whenever urine is filling, it is getting stressed. And whenever the bladder is contracting, it is getting shrunken. So it is showing transition from one kind of the appearance to the other kind. Yes, so it is transitional epithelium. Another name of this transitional epithelium, sir, this is also known as the urothelium. It is a urothelium. Are you getting the thing? Sir, in this urothelium, there is a presence of the our basement membrane. Yes, sir, you will see the basement membrane. Over this basement membrane, you will be able to see the epithelium, the basal cells. Sir, these are our basal cells. Are you getting? Over these basal cells, you will see the multiple layers of the other kind of the cell, and the bottom layer is narrow, but above layer is wide. So this is having the pear shape, sir. These are the our pear shaped cells. Okay, so this is the middle layer. Okay, basal layer, this middle layer is the pear shaped cell. Every cell is having the nucleus. Are you getting? Yes, sir, it is pear shaped cell. But the topmost cells, sir, these topmost cells, they are having the dome shaped appearance, umbrella like appearance. Are you getting? Umbrella like appearance is here. Okay. Yes, the nucleus is there. Nucleus is the blue color. These are having the nucleus. These are having the nucleus. Nucleus is with blue color because of the DNA. DNA is acid. So acid will take the basic stain, and basic stain is having the blue color appearance. Are you getting? This topmost layer is sometimes having the double nucleus also, binucleated cells also visible. And very important, these are covered with the layer of the glycoprotein, which prevents absorption of the urine. So these kind of the cells are known as umbrella cell. Why umbrella cell? Why? Because if you will draw the line, yes, it is having the extra reservoir of the cell membrane. And if you will add the stick, exactly it is looking like the umbrella. So what I want to tell you, the topmost layer is known as umbrella cells. Okay, sir. So this middle layer, they are known as pear shaped cells. And these are our, yes, basal cells located over the basement membrane. And this is covered by the layer of the glycoprotein, which prevent the urine absorption. So this kind of the epithelium is known as, yes, the urothelium. When urine is filled, it is getting stretched, so flat appearance. When urine is empty, so it is getting relaxed and multiple layer appearance. So this is transiting from one phase to the other phase. So this is also known as transitional epithelium. Agree? Done? So many MCQs we covered from here. So answer is definitely the transitional epithelium, urothelium. Now, question, pain of the appendix is referred to. Again, I think this topic is repeated, no? Tell me. Yes, 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 yes. Tell me, pain of the appendix is referred to what? Sir, it is referred to the McBurney's point, sir. It is referred to the our what? Umbilicus. Yes. So we are not discussing too much. Already we had seen, no? Fine. Yes, very nice. The umbilicus is supplied by which nerve? T10 nerve. Sir, appendix supplied by which nerve? T10 nerve. So the pain of the appendix is referred to the umbilicus. Can you tell me this T10 is supplying to which viscera, sir? Definitely umbilicus. MCQ. Sir, it is supplying the appendix. So pain of the appendix is going to the umbilicus. Sir, it is also supplying the gonads. Means the pain of the testis is going to the our, yes, umbilicus, referred pain. Also the pain of the ovary is going to the our umbilicus. Fine. T10 is the no supply. Also you can remember, sir, small intestine is also supplied T10. Okay, fine. Got the point? Umbilicus. Now come to the next question. A 46-year-old woman has hirsutism, hyperglycemia, density, muscle wasting, and the increased circulating levels of the ACTH hormone. The most likely cause of the symptom is, yes, now tell. Yes, very good. All are saying C, C, C. And Disha is saying B. Yes, or other options are there also. The few chromocytoma treatment with exogenous glucocorticoid hypophysiectomy. So B or C, B or C. C here. Hirsutism means our sex hormone problem, hyperglycemia. Okay. Yes, diabetic-like condition, obesity, muscle wasting. Yes, increased circulating level, the ACTH. ACTH is increased in which disease? Sir, ACTH is increased in the Cushing disease. In case of the Addison's disease, there is a decrease in the ACTH. So answer is the B. Okay. Again, look here. Sir, our adrenal gland, it is having the cortex, it is having the medulla. So cortex is again having the three part. GFR is the mnemonic. Glomerulosa, fasciculata, and the reticulosa. Sir, Jonah, glomerulosa. Sir, zona fasciculata. Sir, zona reticularis. Right? Sir, this zona glomerulosa is responsible for the release of what? Mineralocorticoid. Fasciculata. Yes, your mnemonic is the GFR. GFR. The fasciculata is responsible for the cortisol release. Also, you can say the glucocorticoid. Okay, sir. The glucocorticoid. And reticulus is releasing the sex hormone. So whenever there is an increase in ACTH, it will lead to the increase in this all the hormones. Okay. Yes. This all the hormones level are increased. Just give me a few seconds for the urging. Okay, sir. So if there is an increase in the mineralocorticoid, sir, it will cause the more and more sodium and water absorption. So there is an increase in the BP. More in the glucocorticoid, so it will cause the increase in the our yes glycogen to glucose conversion. Okay, sex hormone is increased, so it will cause the hirsutism. Fine. Adrenal medulla, it is releasing the adrenaline, noradrenaline. So if the tumor of the medulla is there, then this condition is known as the pheochromocytoma. Okay, this increased situation due to the increase in the ACTH, that is Cushing disease. Done. So answer in this question is the Cushing disease. Addison disease is the decreased level. Okay, now come to the next. Sir, 18-year-old man with the pernicious anemia lacks intrinsic factor, which is necessary for the absorption of the cyanocobalamin. Okay, right? Cushing syndrome, Sneha. Sir, Cushing syndrome occurs due to the our adrenal gland problem. But Cushing disease is the problem in our pituitary level, no? Fine. Getting the point? Okay. So involvement of the gland, that is adrenal gland problem. Okay. So that is our Cushing syndrome. But the Cushing disease due to the pituitary gland involvement, pituitary tumor disorder. So pernicious anemia, intrinsic factor which is necessary for the absorption of cyanocobalamin. Vitamin D, vitamin B12 is absorbed primarily in the which portion of the GIT tract? Stomach? No. Duodenum? Sir, in the duodenum there is the absorption of the iron. Okay. Fine. Jejunum? No, sir. Ileum? Yes, ileum is the site for the absorption of the B12. So answer is the D. So whenever there is the ileum related problem, so there is the B12 deficiency. Whenever there is a duodenum problem, there is a iron absorption is decreased, so iron deficiency anemia. Okay, iron is absorbed primarily in which part of the GIT? Just I told you. So duodenum is the site where iron absorption occurs, while the ileum where the B12 absorption occurs. Agree? Yes, drama queen. Again, better. See here. Cushing syndrome is your friend. If your adrenal gland is involved, both are in the similar symptoms, no? Because finally the same hormones are increased. So if there is a disease in the pituitary gland, yes, pituitary gland is releasing the abnormal problem on the hypothalamus and the pituitary gland. There's a tumor, this all. So they are controlling the adrenal gland. Okay, fine. So that is our Cushing disease. Both are same. The level of the lesion is different. Okay, but when there is the abnormality directly in the adrenal cortex, okay, and they are increasing the level of the hormones, then it is a Cushing syndrome. Fine. Okay, so iron absorption at the duodenum and our ileum is B12. Again, same thing. So whenever there is a disease of the duodenum, iron deficiency anemia, whenever there is the ileum involvement, ileocecal junction is involved, abdominal tuberculosis, medicine question, Crohn's disease, medicine question, it is involving the ileum and the ileocecal junction, B12 absorption is affected. Megaloblastic anemia will occur. Okay, which of the following is the center for the thirst and hunger? Very good, Sunil. Yes, you are right. Hyperpigmentation also seen. Which of the following is center for the thirst and the hunger? Now, option: thalamus, metathalamus, hypothalamus, and the subthalamus. Yes, Sonali, hypothalamus. Remember, the visceral activity, they are controlled by the hypothalamus. Hypothalamus is the center for the thirst, for the hunger. पानी प्यास लगती है, कौन बताता है? हाइपोथैलेमस. भूख लगती है, कौन बताता है? हाइपोथैलेमस. यस, भूख मिट गई, सटाइटी. यस, पेट भर गया, कौन बताता है? हाइपोथैलेमस. All the visceral activity which you cannot control, they are controlled by the hypothalamus. Sir, which is the reward center? Hypothalamus. Sir, which is the punishment center? Hypothalamus. आपने कोई अच्छा काम किया, आपको चॉकलेट मिली, खुशी महसूस हुई, रिवॉर्ड सेंटर कौन है? हाइपोथैलेमस. अगर मान लो आपने कोई बुरा काम किया तो हमको बुरा फील होता है. यस, पनिशमेंट सेंटर कौन है? हाइपोथैलेमस. ओके. ओके सर. नाउ, in pernicious anemia, autoantibody is found against. Now this is the question. Tell me. A, chief cells, B, parietal cells, C, mucous neck cells, and D, all of the above. Yes. Try the question. B. So Disha is saying B, Urmila is saying B. Yes, Disha, Sonali all are saying B. Perfect. Answer is the parietal cell. What is this pernicious anemia? Try to understand. Again, look here. Sir, suppose this is our stomach. First part, second part, third part, and the fourth part of the duodenum. So here, different kind of cells are located. One cell is the our parietal cell. Which cell? Sir, we are talking about our parietal cells. Sir, these parietal cells are responsible. These parietal cells are responsible for the release of two things. Sir, one is hydrochloric acid and another is intrinsic factor of Ksl. Okay. Okay, sir. This HCl is responsible for the proper acidity and intrinsic factor of Ksl. It binds with the extrinsic factor of the Ksl B12 and causes the our B12 absorption normally. So if there is no intrinsic factor of Ksl, no B12 absorption. Okay. Now this disease, the pernicious anemia, this is the autoantibody disease, no? Sir, in case of the pernicious anemia, sir, very good, Sneha. There is the auto antibody against parietal cell. Okay. So if the autoantibodies form, then parietal cells are destroyed. So HCl is destroyed. So patient is not having the HCl. Means a chlorhydria. Do you remember in chemistry class? Sir, this is the hydrochloric acid. HCl is the hydrochloric acid. So there is an absence. A means absence. Absence of the hydrochloric acid is known as the achlorhydria. Also, if parietal cells are destroyed, then no intrinsic factor of the Ksl. So no proper B12 absorption. So there is the our anemia. Yes, B12 is responsible for the nucleus maturation. So no nucleus maturation. So the cells are having the very big nucleus. There will be the very big cells who are having the very big nucleus. So these are the our megaloblast cells. Just one simple diagrammatic presentation so that you can remember the very big nucleated cells are found. So this is what this is our megalo immature cell, that's why blastic anemia. So again, sir, achlorhydria A. Sir, anemia? A. Sir, there is the autoantibody disease? Yes. So this is the autoimmune disease. Again, A. Parietal cells are destroyed. So there is the decrease in the size. So this is also leading to the atrophic gastritis. The medicine integration. Yes, A. So you can see the autoimmune disease A, autoantibody A, atrophic gastritis. Atrophy means smaller. Gastritis means inflammation of the stomach. Achlorhydria A and anemia A. 5A. You have to remember about this our what? Pernicious anemia. Are you getting? So one formula for all of you, sir. The stay tuned with my Insta and the YouTube channel. You will get such many magics notes there. Pernicious anemia. Sir, magic of 5A. What are the magic of the 5A? You can remember, sir, A, 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 A. Sir, this is our autoimmune disease. Okay, sir. Sir, there is the auto antibody against what? Parietal cell. P for pernicious anemia. You can remember P for parietal cell. Yes. P, P. Yes. A for, sir, there is the destruction of the parietal cell. So, A, trophic gastritis. Sir, it is leading to the atrophic gastritis. Okay, sir. Sir, A for, it is leading to the achlorhydria. Yes, it is leading to the anemia. Which anemia? Answer is the megaloblastic anemia. So this is the one beautiful magic for this pernicious anemia. Are you getting? Everyone clear? Every point is the MCQ. Every point is the MCQ. Right. Sneha. Remember MCQ, 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 MCQ. Okay, done. Now, yes, this is the last slide, the most lovely slide of any class. Thank you very much. Okay, so in doubt, beta, you can ask again. Please ask if in doubt. In doubt, you can ask. Okay, so at the end of the session, yes, एक जिद के साथ, एक जुनून के साथ, एक पागल के साथ पढ़ते चले जाओ। हमको रैंक लाना ही है, हमको एग्जाम में सेलेक्ट होना ही है। और इस दरमियान अगर कोई तुमको कुछ कहता है तो याद रखना, जिसको जो कहना है कहने दो, अपना क्या जाता है। ये वक्त वक्त की बात है और वक्त सभी का आता है। तो दोस्तों बस चुप करके पढ़ते रहो, जिसको जो बोलना है कहने दो, अपने क्या करना है। ओके, यस, खुश रहो, व्यस्त रहो, स्वस्थ रहो, मस्त रहो और पढ़ते रहो। और याद रखो, हमको किसी को जवाब नहीं देना। कुछ देर की खामोशी है, फिर शोर आएगा। औरों का तो वक्त आता है, हमारा दौर आएगा। ओके, तो थैंक यू वेरी मच, गॉड ब्लेस यू ऑल। Sneha, already we explained all the joint. You can go at my YouTube channel also and our different session also. It will take the too much time. Okay, so right now I'm not explaining all the things. Okay. Yes, thank you, Akshada. You can go at my YouTube channel already, and even the nursing next live also we discussed the minute time the joint topic. Na, it will take the too much time. That's why. Yes, Lal Fool, Neela Fool, Shrikant sir, beautiful. Thank you, Rajni. Thank you. We are correcting this one. Lal Fool, Neela Fool, Anatomy, beautiful. Okay. ओके सो थैंक यू, फिर मिलेंगे चलते चलते। टेक केयर एवरीवन, गॉड ब्लेस यू ऑल। एंडिंग द सेशन, टेक केयर, बाय बाय।